Hello again, this is Dr. Nima Aghaebrahim. I'm a stroke neurologist and a neuroendovascular surgeon. And today I'm going to talk to you about stroke treatment. In the previous talk, we talked about what is a stroke. Loss of a brain function due to a problem in the blood vessel leads to a damage in that part of the brain, which can cause weakness and numbness or problem speaking, for example, depending on where the problem occurs. That is a stroke. Stroke is the number one cause of disability. We talked about that stroke is an emergency, and stroke can cause weakness or numbness on one side of the body because different part of the brain affects different part of the body. Today, I'm going to talk about how stroke can be reversed or treated. So treatment for ischemic stroke, that is a non-bleeding kind, the one that caused by blockage, depends on the kind, location, where it is, and how much problem it causes. But acute treatment or early emergency treatment is available to reverse stroke symptoms in some patients. However, to do so, time is very important. So let me rephrase. Some patients' stroke symptoms, the disability, can be reversed if they are treated early. However, because of the time, it's very important to recognize, call 911, and seek treatment as early as possible in a facility that's equipped with be able to provide such treatment. So early emergency treatments are typically two. The first one is a clotbusting medication, or called TPA. Now, this drug was approved in 1995 and is being used to help dissolve the blood clot. The way it works is injected through the vein, and it helps by dissolving these blood clots. The drawback, however, is for it to work, it has to be given really early, up to 4.5 hours. And some patients who are on blood thinners or have bleeding disorder may not be able to get it. Let me show you. So it is a drug, and it comes into 2 vials. And what we do first, we have to recognize that it's a non-bleeding stroke. That's done by imaging, CAT scan, for example. Then we have to figure out how much disability is causing, figure out when the symptoms onset was. And it's not really just symptom onset, it's just really when was the patient last seen normal. And then a few other things that we have to use. And if the patient meets the criteria, these 2 medications are mixed. After they're mixed, patient is weighed, and based on the weigh, there's a bolus that's given, followed by a continuous injection over 1 hour. But this is a clot-busting medication, or the TPA. Clot can also be mechanically removed from the brain through a minimally invasive technique called stroke thrombectomy or neovascular stroke therapy. Let me show you. So if you see the brain, their main blood vessel or large blood vessel that carry blood and nutrition to important parts of the brain. If a big clot goes up and blocks this blood vessel, this blockage can be removed with the tools that we have to restore blood back to the brain. It is also time sensitive, but also we know that it's very, very effective. And this has been approved in 2015. Let me show you. We have great devices that can do this. So basically, we thread the small catheter from the leg all the way up to the brain. All the blood vessels in the body are connected. So through the blood vessel, we can travel up to the brain. We inject dye to figure out where the blockage is. Then we go through that blockage with the devices that we have. So if you look at here, these are very small devices that can travel through the blood vessel. And once the blockage is reached, these devices can be deployed and literally grab the clot and while we're aspirating through this tube, which is very flexible, we can remove the blood clot by removing the devices, and we get the blood clot out of the body. These devices are FDA approved, and by doing so, we restore blood and nutrition back to the brain. As I said earlier, these are all time dependent. So think of everything that happens when somebody has a stroke. First, somebody has to recognize, call 911. EMS has to evaluate the patient. They can provide certain treatment on the scene. They have to take the patient to appropriate place. The patient then has to be evaluated. So time passes very rapidly. Brain imaging is important to make sure it's not bleeding, and then treatment can be offered. However, to be able to provide appropriate treatment for stroke, you need a whole comprehensive team of different services and different healthcare providers. Thankfully, in Baptist in Jacksonville, we have a great team who can provide the best care possible for stroke patients. So remember, time is brain. If you notice that somebody has a stroke, call 911, and treatment to reverse stroke symptoms are available. By the way, if you see this in social media or any other media, please feel free to write questions in the comments, and we try to get back to you. Thank you very much.